conception of this show that even though the coronavirus is a physical ailment and everybody's doing what we can to steer clear of it, or as we saw from Tomas Manglonia earlier, there is now treatment for that in various ways. You can find out much more on our YouTube channel, our website. The mental component of what we've all gone through as a global society over more than a year and a half is equally important, and in some ways even more long-lasting than the physical. And I'm glad I have two friends of mine that are experts in this field from the Guam Behavioral Health and Wellness Center, Dr. Christiana Whitman and Sarah Harrell. Ladies, it has been a very long time, and when you guys are here, you know, it always gives me a sense of peace.
Oh, thank you. Good morning.
we were talking about self-care during the break. Interviewing wonderful people like you is my self-care, because you give me a self of reassurance that, you know, that we are working together to get through this and everything. So, and that's kind of the point, right? Because there is a Focus on Life virtual conference that you guys have coming. Was that next Thursday, Doc?
Yeah, so it's Thursday and Friday, and I'm going to kind of correct the title. So it's the Go Peace Conference, and it is an initiative out of the Peace, or the Prevention and Training Office, through Guam Behavioral Health and Wellness Center. Both Sarah and I have grant funding that we're utilizing to bring our projects together to host this conference. Yeah, so we're really excited about it. It's next Thursday and Friday, and there are still spots open to register.
Yeah, we're going to bring the poster up so everybody can see that. But Sarah, there are a wide variety of topics. In fact, I would say like this is going to affect probably everybody to some degree, because just looking at the poster, it says holistic wellness is one of them, grief recovery, which, you know, invariably everybody is going to go through, self-care, as we just mentioned. But also interesting is the impact of data.
Mm-hmm. So the conference is really designed for people who does prevention work. And I know people might think, oh, I don't really do prevention. But in actuality, all of us who work with youth, who work with adults and making sure that they're healthy, both physically and even emotionally and mentally, we're all prevention practitioners. So if you see yourself helping people out, especially during the past 18 months of the pandemic, and you've been of service to somebody else, you are a prevention practitioner, and this is for you. So the workshops that we've developed has actually like a 3-step theme or process. It's listen, connect, prevent. So what we want people to get out of the conference is not just to listen and learn from people or like experts, but also to feel like they're listened to, or that they're validated, their experiences are validated, because they're hearing from people who they can relate from, like their experiences are similar to theirs. So we want to feel like people can listen to others, but also feel like they're being listened to. We also want the conference to be a platform to be able to connect to people who are not necessarily like-minded or in the same field, but people who have the same passion in life, which is helping others out. I think like in social services or in the field of prevention, that's one common denominator among us. Like we're all helpers. We all want to care. We have a huge care tank that we just want to keep giving. And then the last is really prevent, like really finding the reason why they're in the field of prevention, why they're doing prevention work. And not necessarily just, you know, like tools of what they can do when they go back to their companies or organizations, but also like, how can I prevent my own mental wellness to go on disarray? Or how can I take care of myself? How can I practice positive self-care and healthy self-care so that I can keep giving and caring for others?
Mm-hmm. And Christiana, you said something very, very profound. I remember the last time we had you on is you were saying what we've probably all come to realize, even indirectly throughout the pandemic, is that, you know, communication really truly is a two-way street. And if you really want to get good, and as Sarah said, you know, like really help somebody and help yourself, you have to both listen and talk.
Yeah, absolutely. And thanks for remembering that, because I don't remember that. It's a reminder that, you know.
It was really good. I stored that up here because it was good.
Oh, wonderful. Thank you. So it is a two-way street, and that's really what we're hoping that this platform provides to stakeholders, prevention professionals, and people in the community, just this space to listen and to connect and to talk with each other and amongst each other about maybe some of the challenges they've had in the last 18 months or in their careers, but also some of the strengths. We've seen so many strengths come out of people in our community over the last 18 months. And I talk a lot about the pandemic silver linings, because that's what brings me joy. And one of them is this emphasis on self-care and wellness and mental health. And I think if we use it as a platform to kind of destigmatize getting mental health services and promote and capitalize on self-care and overall holistic wellness, I think that's going to be really good for our community overall. So that's kind of where we're going with this conference. It's not going to be your typical, providers who are at this conference giving presentations, although there are providers. But we do have, an array of services. Like we said, we look at data every day, especially, we're looking at these COVID numbers, and, as we also want to know how can we make the data speak, positively for us and for the people we're trying to reach. So Dr. David is going to be doing a workshop about that. We have some people in the community who've actually started a mental health podcast, which has been a great source of support to many people in the community who just want kind of a sounding board of people who have lived experience. And they've been able to invite different people across the island to be in their platform. And then we have, in the afternoons where I think Sarah and I are most excited about this, and our team is most excited about these workshops in the afternoon that are really focused on resetting and recharging. So we brought together nutrition experts, yoga masters, traditional, I don't know who else did we have there? Brief recovery. So just different spaces to really communicate this message that prevention and mental health is really so multifaceted and dynamic.
And I really appreciate a term you used there like a few moments ago where you said like silver linings, and in both of your professional opinion, like as as advisors, as clinicians, what have you, how much of like actually telling a friend, a member of your church, maybe a family member and everything like that, giving them like those little incremental things to look forward to, or say, it is going to get better, things will eventually calm down, we just have to keep working and everything like that. How has that been managed? Because I'm looking at it because, I tried to major in advertising and everything, and you always want to shoot for a goal, right? But when it comes to, the mental health aspect about saying, there is a light at the end of the tunnel, or, all these cliches and everything like that, how do you balance that maybe even within the family unit?
Sarah, I'll start off and you can add to it if there's something. But I was going to say, I constantly or consistently try to tell myself, since we're talking about myself, but also my clients or the people I serve, or even students I do teach also. But there's going to be a period, we need to be realistic. There's going to be a period of yuckiness, right? Of discomfort, of uncertainty. And that's kind of, for a lot of people, that's where we are still. And it's been kind of long. And, we can admit that. At the same time, though, it's only that period of discomfort that's going to bring you to the space where you're comfortable again, and then where you're able to kind of look back at the last period of time and say, wow, I was resilient enough to get through this, right? And everyone, we were talking prior to this, right, prior to actually being on air, about self-care, and everyone has different methods or mechanisms for getting to achieving or obtaining self-care. For some, that's professional counseling, professional therapy. It could be medication. For others, it might be just, reflecting, spending time with family.
It's tacos for me.
Yes, exactly. Tacos,
yeah.
Taking a walk, getting fresh air, or, a combination of everything. And I think, again, I guess one of the things we want to kind of just bring home is that, mental health prevention are, there's no real, there are evidence-based and clinical practices. And we, of course, I'm a provider. I believe in it truly, but, that type of help seeking isn't always for everybody, right? And so we do want to kind of share that there are other approaches to achieving wellness and, and taking care of yourself. And I don't know if Sarah wants to add to that.
Yeah, I mean, definitely agree. Like, everybody is in some sort of healing process, and integral to that healing process is the social support. No man is an island. We always need the cushion of our family, our friends, people that we work with who we know understands where we're coming from, is willing to listen to us. When we talk about like mental health, sometimes like the connotation or like the misconception is that it's people seeking help from counselors or from clinicians, but really everybody has mental health, and all of us, like about 92% of any community, do some sort of way to manage their mental health, and it's not necessarily going to counselors or seeking clinical help or services, although there's nothing wrong with that. But majority of us really just depend on having some, like vent sessions with our friends, or having some coffee break time during the afternoons with our coworkers, or having a retreat like this conference with people that we share the same work with. So everything that we do has an impact on our mental health, and we have to be more conscious about that.
Mm-hmm. Now, even though this is a virtual conference, ladies, before I let you go, I'm assuming it's going to be standing room only, even though it's virtual. But is registration required?
Yes, registration is required, but there still is availability as of right now. I'm not sure what the recent count was, but it is a virtual conference. We are trying to be as interactive as possible. So we're trying to mitigate some of the technical challenges by actually having our presenters be present in a room and to share, to live stream from there, so that so that's hopefully is going to give the feel to the participants from their homes or from their workplaces, a sense that the conference is actually still like happening in real time and in real life. But safely. So unfortunately, we were really trying to do a hybrid conference, and it didn't work out. But we're happy to still do something and be here for our community. I'm not sure, Sarah, if I know we gave you the flyer, Jason.
Yeah, we got the poster up right now.
There.
So everybody, if you can't read it on your screen, you can register at tinyurl.com/gopeace GOPEACE 01. tinyurl.com/gopeace 01. And this is something that affects everybody, and because it's virtual, and free to the public as well.
Free, yes.
Free.
Yeah.
That's a key element.
Yeah, if I may just add, I know that
Yes,
it's
please.
on a Thursday and Friday, so some people might be working. So if live participation during the conference is not an option for you all, all of the workshops will be recorded, and it will be available as podcasts on our website, gbhwc.guam.gov. That way, anyone and everyone can take advantage of the amazing presentations and speeches that we will be offering at the conference.
Excellent. Well, once you guys are done, we'll share that too, so we can make sure that we share the knowledge, because that's what it's all about.
Thank you.
Okay, ladies, thank you for what you're doing for our community. This is a very, very necessary service, and it is our sincere hope that everybody takes advantage of it, because it's a wonderful thing to do.
Thank you.
Thanks,
so much.
Jason. Thanks
All
for
right.
having us.
All right, best of luck. We'll see you soon. We will see you on the flip side of this break. Please.
We know you're tired of hearing about COVID-19. Some of you are probably wondering whether this is ever going to end. However long it takes, we all have to do our